We have heard already that we have now more than half of the population, about 4.4, maybe already 4.5 billion people living in cities, and this number is rapidly growing. It is growing mainly right now in East Asia, South Asia, Africa, and I think there the vast of the population is moving into cities. Now, already now we have about 45, depending on how you count, 44 or 45 megacities, which have more than 10 million inhabitants in each of those cities. Huge conurbation areas, and unfortunately, most of those people are moving into the cities not because they have a nice downtown apartment. They are not looking for penthouses. Most of this movement is in precarious situations. Actually, most of this movement we see right now is a catastrophe in itself. So the question of urban health is not a luxury question. With having a large part of our population living in conurbation areas in cities, it is a question of survival. And we have no choice than other to take care of it and to deal with it. And my question, of course, here is, what makes for us a city livable? What makes it healthy? And I would like to address this question first, a little bit summarizing of what we have heard in the panel, and then trying to find out where are the health frontiers. So what is it actually that we have to do in order to make cities healthier, more livable? And I will try to conclude, and I can already say that I may add a very personal conclusion and finding to that, which may some of you surprise with that. Now, just for the heck of it, I said, well, let's get a little bit help from a friend, and I asked ImageFX, show me a healthy city. And what I saw then was, well, not really promising. You may like the tattoo on the arm, but the city is rather a dystopian picture of a city and not really what I would say is a healthy city. And a second attempt with ImageFX was this one. Well, the apples may be healthy, but the rest is really not appreciable. It was a little bit better with DALL-E, and they came up with a city which already has some points in it which may be of interest for us. You know, renewable energy, a lot of spaces around for walking, for bicycling, public transport, a lot of greening in the city, not too much traffic by cars on the road. And to me, that is a little bit more appealing, although I'm not sure whether I would like to live in that city or not. So let's see, what are the points that we are looking for? And I think we can sort this into three big areas which we have to look for when we are looking for urban health: the social determinants of health, the environmental determinants of health, and yes, we also have to look on the healthcare systems themselves, because people get ill, people need healthcare, people get frail, and they will have to be looked after. And when we talk about the environment, there are these factors which we heard about this morning already, which are important for our environment to determine on how healthy we can be. It is, do we have air and water? Are the rivers clean which are going through our cities or by our cities? Is the air healthy? Do we have emissions in the city or coming to the city which are important? And the emissions can come from far distance, especially with microparticles. Do we have sanitation and waste management in the cities? And actually, for many of the megacities, this is not a given. We still have problems there. So does it produce an environment that is inhabitable for us, that gives us walkable surrounding spaces for leisure time, for sports, which are bike-friendly, where you can send your children out by bike without the danger of being run over at the next corner? Do we have sustainability in the town with the use of our resources? Do we have smart transport in a city? This is certainly smart for the situation given, but that is not my idea of smart transport, of course, for a future, but a reality nowadays. We talk about the social determinants of health, and Margaret Chan phrased it as the way we are born, we live, we learn, we work. And those are the factors, to a large extent, determining whether we have a chance to have a healthy life. Do we have proper housing? Do we have educational opportunities? And I'm not only meaning professional educational opportunities, but do you have basic educational opportunities? And I'm always shocked when I hear that there are still countries where people have to pay for their children to go to a basic school. I think that that is completely incompatible with having a healthy future. And the same is true for decent workspaces. Are our workspaces safe? Are our workspaces healthy? Or do we have a city with a lot of workplaces which are itself dangerous and not sustainable? And we have heard about the question of health deserts. We have very, very rich cities in which quarters you cannot buy healthy food. You get every kind of junk food around the next corner, but try to get healthy food, vegetables, fruits at a reasonable price, you will find that you fail. Yes, and finally, we also have to talk about the healthcare system. And to me, it starts when you look at the urban health with a very strong public healthcare system. But you also have to have equitable access to healthcare. A structure has to be there in order to treat people, and it needs also the right infrastructure to be there. And we have to provide outreach to vulnerable groups. We have, in all of the megacities now, large populations of elderly people, of impoverished people, and also of migrants, which have specific needs, for instance, just by speaking a different language. So where are the urban health facilities? What is it that it determines whether you live in a place that is precarious and rather not worth living in, or whether you live in a very nice surrounding that provides you a situation for health? And my most important call here is, and I think we have heard that before, making the cities a healthy living space is a priority. That for all politicians which are structuring, governing cities should be very high on their agenda in the planning. And urban planning is it, and my president, Lujane, she said it already, it's a team-up exercise. It is not only an exercise for one specific group, for city planners, or for politicians. It is really something that has to be done multidisciplinary and together in order to really provide healthy spaces. We have to consider the climate change as well. It is something which now has, for instance, in my own country, in Germany, very suddenly surprised us that we had floods in cities which we never had before, that we have tornadoes in places where we have never seen before. All of these are factors coming with climate change, and I guess no part of this world is safe against that. So there are changes which we have to include in looking to. We need to have living spaces close to work. The separation which we have done in the past doesn't work anymore. We have to come closer, or we have to use tools like telework, and we have to get the traffic safe and public and provide walkable spaces for our people, bicycle-friendly, pedestrian-friendly, that they can work. We need for this, and we have spoken about that, and we will hear a little bit more about that, we need more innovation. And for each of the measures that planners should do, that politicians should decide, there should be also a predictive analysis on the health effect. This is, by the way, not only a health prediction, it is also a part of generational accounting. Which world are we leaving for our children, for our next generation? We should employ the smart technologies in the cities that we can use. We can use a lot of new technology in order to predict development in cities, but also to govern cities to have better spaces. Climate planning is a very important one that we can do. Public transport, I mentioned this already. Structure our building infrastructure with that. Water supply and sanitation, we have just heard about it, how important it is, not just to clean wastewater, but also to monitor wastewater, what happens with that. And for all of the cities, and the colleague from Abu Dhabi said it, we have to consider in many of the states to leapfrog, because it doesn't help to just copy solutions from the past. They may not fit for the future in the first place, but they may be also too expensive to simply copy them in that. And another plea, and I think I have heard it in the panel also, is use data evidence for decision making. Collect the data, analyze the data, and afterwards ask, was this the right step? Do we have to correct? Or what can we learn from the future? I mentioned it. Affordable quality housing is important. If you have a large population of living in sheds, in slums, you can do what you want, you don't get health in that. You can put as much of antibiotics into slums, you will not get rid of tuberculosis. Not possible. You have to change this. It is important. Education, important factor to empower people there. Access to food and water must not be a luxury. I said this is something that city governments have to make sure that this is in place. You need the occupational health service and safety for all peoples and all workers in that. And very important, take your communities, your civil society as a resource. Inclusion is important, and inclusion also has to reach those who have, for instance, language problems. And we have now language divergent communities in all of the mega cities of the world, and that is not an example. I said that public health service has to be there. It is a part of your basic structure. You have to provide the equitable health care, and to me, universal health coverage is the answer. It also has been mentioned briefly in our decision, and universal health coverage means really universal to the extent what you offer, and also that it is there for everybody. Mobile technologies can reach out, especially to special populations, elderly. Language problems can be bridged with for instance, AI, which is already being done and very helpful. And again, use data evidence. So my take-home messages here are: health has to be in all policies, and it is a must for urban development. Health has to be considered in all of the policies and projects you do. It is an investment. It's not a cost. And you have to tell this to the people who are in charge of the finances. And innovation can pave a way to this, but it's not a panacea. If you don't fix the other problems, if you don't look for the social determinants of health and for the environmental determinants of health, your technology will not help you in the end. Technology is an important tool and has to be applied, but you have to look for the other things there. And finally, a very private note. Our cities are places of culture, of heritage, of legacy. And I think it is worthwhile to consider the thought to make small cities livable and not just to let happen what happens right now, that everything runs into the big urban conurbation areas. Small cities are very often worthwhile cities to live in. They have magic, actually. And it's something that we should consider to preserve for our future and for our children. But let me predict, the real luxury of the 21st century are small, livable, healthy cities. Unfortunately. Thank you very much.